Hi sir, good day. This is Miss Princee Mae Mañigos, and today I will going to record my oral recitation blindfolded. Alright, so for question number 1, describe the classification of clinical laboratory according to its function, institutional characteristics, ownership, and service capability. So my answer for that is we can classify a clinical laboratory according to its function, institutional characteristics, ownership, and service capability. Its function includes clinical pathology and anatomic pathology. Clinical pathology, it is concerned with the diagnosis and treatment of disease performed through laboratory testing, while anatomic pathology concerned with the diagnosis of disease through microscopic examination of tissues and organs. And according to its institutional characteristics, it has two kinds: institutional based and freestanding. Institution-based is a clinical laboratory that operates within the premises or part of an institution. Hospital-based clinic laboratory are the most common example of it. While freestanding is a clinical laboratory and is not part of the establishment or an institution. The most common example is a freestanding outpatient clinical laboratory. According to ownership, it can be government-owned or privately owned. Government-owned clinical laboratory are owned partially by national or local government unit, while privately owned refers to a clinical laboratory that is owned or established or operated by an individual, corporation, institution, association, or organization. Lastly, we can classify clinical laboratory by according to its service capability, and it has the following categories, such as primary, secondary, tertiary, and national reference laboratory. Right, so for question number 2, describe the laboratory testing cycle. So the laboratory testing cycle is of course a cycle that has 3 phases. These are the pre-analytic phase, the analytic phase, and the post-analytic phase. The laboratory testing cycle encompasses all the activities starting from the medical doctors and writing a laboratory request up to the time that is called turnaround, or the TAT. The results are generated and become useful information for the treatment and management of the patient. So for question number 3, how important is quality assurance in a clinical laboratory? Quality assurance or QA is important in the clinical laboratory because it encompasses all the activities performed by the laboratory personnel to ensure the reliability of test results. Yes. In addition, quality assurance in the clinical laboratory has two major components. These are the internal quality assurance or the IQAS and the external quality assurance or the EQAS. IQAS includes the day-to-day activity that are undertaken in order to control factor or variable that may affect test results. While on the other hand, AQAS is a system for checking performance among clinical laboratory and is facilitated by the designated external agencies. For question number 4, pick two sections in the laboratory and describe its based on the services and the services it provides. So there are various sections of the clinical laboratory. So I will be going to pick the clinical microscopy and the microbiology section. Clinical microscopy has two major areas in this section. So these are, the first areas is the allotted to the routine and other special examination of urine, such as microscopic examination to determine color, transparency, specific gravity, pH level, and microscopic examination to detect presence of normal cells or parasites, as well as quantify red cells and WBC and other chemical found in urine. So the second area is assigned to the examination of stool or return or fecal analysis. Detection and identification of parasitic worms or ova are the primary activity in this area. In the microbiology section, the work in this section is more focused on the identification of the bacteria and fungi on the specimen received. Specimen usually submitted or blood and other body fluids, stools, tissues, and swabs from different type in the body. Tests include the microscopic visualization of microorganisms after staining, isolation, and identification of bacteria and fungi. It is usually varied cultured media and different biochemical tests. And at times, antigen typing and bacterial susceptibility testing. Although not as automated clinical chemistry, automated instruments are available, such as those used for blood culture and antimicrobial susceptibility testing. So for question number 5, for the last question, we have explain why medical technologies are significant members in the healthcare delivery system. So, medical technology is a critical component of the healthcare industry. It contains medical devices that make disease prevention, diagnosis, and treatment easier. Pacemaker imaging instrument, dialysis machine, and implant are the most well-known medical technology products. Medical technology has the potential to save lives, improve health, and contribute to long-term healthcare solutions. Patients, healthcare professionals, healthcare systems, and society are all benefit from all the industries from those equipments and tests. So that's all for my oral recitation, sir. Abi ko wala na ko na